Good afternoon, everyone, and welcome. My name is Dr. Anika Daniels-Osaze, and I'm the Director of the Diversity Education and Research Office here in the College of Medicine. And I'm glad to see this room is packed today. We have two events that are happening today. One is the Dr. Samuel L. Kountz Jr.'s lecture on Black men's health. Today we're going to discuss violence and its impact on Black men's health, and with a specific focus on an organization known as KAVI, Kings Against Violence Initiative. And then afterwards, we will be celebrating some of the men here at Downstate who have given all of their energy and commitment to making Downstate run efficiently, effectively, and helping to serve all the offices that are here represented at Downstate. So before we get started, I'd like to thank our co-sponsor, the Arthur Ashe Institute for Urban Health, and introduce you to Dr. Mary Valmont, who will be serving as our moderator and is the director of the Health Science Academy here at Downstate with the Arthur Ashe Institute. So without any further ado, Dr. Mary Valmont.
Thank you. Good afternoon and welcome. It's my pleasure to be here as a co-sponsor from the Arthur Ashe Institute. And I'm going to serve again kind of as the moderator in an important role, the timekeeper, to make sure we stay on track. So as just said, the first part of this is a lecture on Black men's health, violence, and its impact on Black men's health. And this is always a timely topic, but particularly so given what's happening in the country. So I'd like to introduce our two speakers. The Arthur Ashe Institute has worked with KAVI in the past. They have a middle school program. We have a middle school program. We did some stuff for them last summer. Several of their members are active in our organization, so it really gives me pleasure to further develop our relationship with them. First speaker, or they're going to speak together, gentlemen, you can, is Mr. Tanjaji Bailey. He's a community intervention coordinator. Have a seat. Is that too close for you? Fine. And Mr. Muhammad Waritala, who not only is an intern of KAVI, but he's also an instructor at the Health Science Academy this year. As much as possible, the Health Science Academy, which is a 3-year after-school program here at SUNY Downstate, we try to recruit grad students of color here to teach our students because it's great modeling. They see someone considerably younger who's in grad school, and they can ask them all kinds of interesting questions, which I'm sure they've asked you. So thank you for being here.
Assault accounts for 50% of deaths among non-Hispanic Black males between the ages of 20 to 24.
And for Black males ages 10 to 14, assault and gun violence is the second cause of death, only behind accidents.
For Black males between the ages of 15 and 34, assault is the leading cause of death.
So while these statistics are very alarming, we know that this does not mean that Black men are inherently violent. We know that there are so many factors that come into play when we are discussing why Black men, why Black boys are experiencing and are dealing with violence. Some of those reasons include poverty, access to educational opportunities, as well as generational trauma. Good morning, everyone. My name is Tanjaji Bailey. I am the Community Intervention Coordinator for KAVI, Kings Against Violence Initiative.
And I'm Muhammad Muritala, currently a 4th-year medical student here at SUNY Downstate. I'm also a volunteer and research analyst here at KAVI. And today we're going to be talking to you about Black men's health, and more specifically, we're going to talk about violence and its impact on the youth. Now, before we begin, we just want to have a word from Dr. Robert Gore, who couldn't be here today. He's the founder and executive director of KAVI.
Your perspective changes when the trauma becomes personal. I distinctly remember that he was young, Black, and he looked like me. He was covered in blood, the same as me, but the only difference was that he was a patient who laid on a stretcher after being shot in the face and the chest, and I was the physician who pronounced him dead. He was killed by another young man that looked like him, who was also being treated for gunshot wounds in the room next door. Coincidentally, The perpetrator was shot 2 years prior by the dead man. This unfortunate scene of young black men being brutally injured or dead because of violence is common where I work. But despite its frequency, I keep asking myself why. According to the Center for Disease Control, the #1 cause of death for black men ages 15 to 34 is homicide. Not illness, not accidental injury, but death due to force. And it's difficult to understand the how and the why of violence when you don't see the effects of violence up close. Like when there are regular shootings on the other side of the city, police brutality in someone else's community, illegal gang activity in someone else's school, or war in someone else's country. But recently publicized mass casualty shootings have shown us that we are all vulnerable regardless of where we live, which makes the bystander and the veteran, the teacher and the sibling, the first grader and the gangbanger all equally affected by violence. And if they do survive a violent injury, how the consequential post-traumatic stress is diffused will depend on the immediate treatment the survivors receive. Early in my training, I became familiar with the concept known as the golden hour of trauma, which stresses the need for early treatment the first hour after a traumatic injury. I later learned of a concept known as the second golden hour of trauma, which stresses that an early intervention could change the scope of violent injury and make sure retaliation doesn't occur. It's almost expected that a survivor of a mass casualty shooting be offered both counseling and victim services. There's usually a different level of empathy shown towards these patients, but that doesn't always happen when you have a young black or Latino male that comes in shot. Had those services been available, I wonder if an early intervention would have prevented retaliation from occurring between my two patients, because it was obvious that the two were suffering from something that hadn't been addressed yet. I get angry pronouncing young black men dead, and I get frustrated at the limited psychosocial resources available to victims of gang and interpersonal violence. So to better cope with my work reality, and in the spirit of the second golden hour of trauma, I put together a team made up of friends, family, colleagues, and students, and we developed a hospital, school, and community-based violence intervention and prevention program called CAVI, also known as the Kings Against Violence Initiative. We work with patients that have been injured because of violence, and we work with at-risk youth to make sure they don't become patients, but more so to help increase opportunities that extend beyond street life. And we do this work through mentoring, counseling, and programs that help our participants develop coping strategies and tools to deal with life stressors. A while ago, I heard a phrase, hurt people, hurt people. I'm going to say it again, but this time slower. Hurt people, hurt people. Because when you're hurting and have no one to turn to and have no one to talk to, it's easy to feel marginalized. It's easy for you to want others to feel the same exact pain and suffering that you've been experiencing. Like one of my students. One of my students had been going through some personal problems, and he's also in a gang. But he decided to put a hit out on another student to have him killed because of a recent beef or conflict he had. Luckily, he retracted the hit after extensive meetings with our staff, but my student, along with so many others that look like us, are hurting. And the reason they're hurting is because they haven't processed or dealt with or treated their past traumas. They're constantly reliving their traumas. And when the code of the street tells you if there's a conflict that you have to respond aggressively, it makes perfect sense that you're going to use violence to deal with your problems, thus continuing the cycle of trauma. And when these emotions and these experiences go unchanged and unchecked, and you put that in an unforgiving environment, there's eventually a tipping point, with the result being a violent aftermath, making it easy for the unsupported to become the perpetrators. My students don't want to be in gangs, and my patients don't want to be victims. They want to go to school, they want to go to work, they want to be validated, they want equal opportunity, but most of all, they want to live. Thank you.
Very powerful speech by our founder, Dr. Gore. Now, we would like to give you an opportunity to talk with your neighbor for just about 1 minute. And think about this question. What forms of violence are you exposed to, and how does that impact you directly? So I'm going to send you into a turn and talk where you have a chance to discuss this question. And then I'm going to do something called a call and response to pull you back. This is something that I actually use with my youth and my groups. And it comes from West Africa. And it simply says, the leader, the person that's speaking says, I go, and the community responds, I may. So I go simply says, may I have your attention? And I may says, yes, you may have my attention. So as you're speaking, I'm going to say, I go, and I want everyone to say, I may. So we're just going to practice before we go into the question. Just kind of chit chat, just kind of fake talk for a minute. Fake talk for a minute.
You're good.
Excellent.
You're good.
I go.
I may.
I go.
I may.
Excellent. It should be just like that. So again, think about this question. What forms of violence are you exposed to, and how does that impact you directly? Take about 1 minute to turn and talk.
What kinds of violence have you experienced?
Hi, how are you? I'm well. I'm just trying to listen to the conversation. Good to see you as well. I'm well. I'm just listening. I'm sorry.
Does it makes you? Definitely. What kinds of violence did you say you were exposed to? What kinds of violence do you feel like you were exposed
I go. I go. Nice. Is there a volunteer who'd like to share what you discussed with your partner, with the person sitting next to you? If not, I have someone who can.
Hi, I'm Pam Straker from the Mental Health Disparity Center, and we were talking a little bit about the impact of media.
Thank you so much for sharing. So much. I go. Great. We're going to continue with our presentation.
So we can see that we've all been exposed to different forms of violence. But now let's go back to the statistics that we showed earlier. Young black males. The real question is why? Why are they being exposed to higher levels of violence and assault than every other subpopulation in America? It could be a little bit of what Ndaji alluded to earlier. It could be a little bit of what Dr. Gore alluded to in his presentation, including some of what you guys said, community trauma. You could also deal with the fact that there's gun violence, there are gangs, police brutality, mass incarceration, decreased educational opportunities, and being from a low SES community, having a low socioeconomic status. And of course, the generational trauma. This shows that these deaths amongst black males, it's not just a problem within our community, it in fact is a public health issue.
So we're going to share just a little bit about ourselves.
So, as you can see, this is me. I'm a first-generation Nigerian American. I'm the last of 4 kids, and my closest sibling is 5 years older than me. I was born and raised here in Brooklyn, New York, and I went to Benjamin Banneker High School, which is right there in Fort Greene. And my experiences growing up, they were fun for the most part, also traumatizing as well. As I stand to you today, you may not know this, but when I was a freshman in high school, I was only 4'11". So you can only imagine how rough it would be for a short black male getting on a train with his big book bag, every day. And for the most part, it was okay until I started attending Saturday classes at my local high school. This was not just filled with people from Benjamin Banneker, but kids from other high schools. And throughout that time, I was picked on, I was bullied. It went from a point of being verbal to it being physical, to a point that I can remember being carried, lifted out from the cafeteria down 2-3 blocks of the school. Of course, that event was very traumatizing for me, but it deals more with how I had to deal with that issue. With the following weeks that came along, I was approached by another member of the school that asked me if those people in the blood gang were bothering me. And at that point, I realized I had a choice to join this gang, which he was a member of the Crips, and he's asking me if I wanted to join so that I could retaliate against the other students, or say no, that they weren't bothering me. Now, me feeling the way I felt, 14-year-old kid, did I want to retaliate? Yes. Did I feel hurt? Yes. But something in me, whether it was the drive to knowing that I wanted to become a doctor, whether it was the fear of what my parents would think if I joined the gang, who knows what it was. I said no. And that decision, just like every other decision I make in my life, got me to the position that I am in today.
That's right. All right.
April 1978. A 33-year-old black woman is walking home from work and is picked up by 2 white men and 1 white woman. This black woman is never seen again. When her body is found about 3 months later, there are 3 letters that are etched into her stomach that indicate the true intentions of her murderers. This black woman was my great aunt, Betty Gardner, my grandmother's sister. Her children never recovered from this traumatic event because they did not have access to mental health services to process and deal with the trauma that comes from dealing with white supremacy in this country and really the effects of slavery that we've all been enduring. Excuse me.
We've all been exposed to trauma.
I want to finish. Thank you. So, if we are exposed and we get the opportunity to get access to mental health services, which is something that I have had to seek over the past year, because we've been living, and I have been living, we all have been living in a country that has been shouting back to us that all lives matter, when all I have been trying to say, all that we have been trying to say, is that I'm worthy, that I'm valued. We are valued. And in order for us to deal with this back and forth, I think the thing that we all must do to get through the next 4 years, hopefully not the next 8 years, is for all of us to seek some therapy. Black men in particular do not go and get therapists. And I luckily have, because of Kavi, had the opportunity to work with a black psychologist who's kind of worked with me and talked with me through some of this trauma, with my family, with the community, with the kind of national effects that we're all dealing with. And now we will move on.
So as I stated earlier, we've all been exposed to trauma.
And we've all been exposed to violence.
But how do we combat this violence and trauma that we face, that we internalize? How do we get through to the next day? When it comes to me and my personal experiences, yes, I can say that it's because my parents were very strict. So maybe the fear is what kept me going. But I know that I can't say it was the support. They focused more on my educational attainment. They focused more on the academics. I did have older brothers and sisters, but as I stated earlier, my closest brother is 5 years older than me. I was a freshman in high school. He was already in college, similar to all my other siblings. So as much as I did have family, as much as I did have friends, I still felt like I lacked the support itself. So how did I get out of it? Most of it, I attribute to luck, honestly. I made the right decision on the right day to do the right thing. Other peers of mine made the wrong decision on the wrong day, and they're not with us today. They're either incarcerated, maybe 6 feet under.
And for me, it has been having the support of mentors. There are 2 mentors who have been mentoring me since I was in middle school. I'm going to sing a song that you may recognize from them. Come and let's play together in the bright sunny weather. Let's all go to Gullah Gullah Island. So the parents from that show have not only been mentors, but they've also parented me as well. And having mentors like them gave me the opportunity to be exposed to my culture, to have pride in my community, and then to share that pride and share that knowledge with the people that I serve. So what can you do?
Currently, we have programs as part of the Cure Violence Initiative within New York City, such as the Youth Organizing to Save Our Streets, also known as SOS. There's the Gangsters Making Astronomical Community Changes Incorporated, also known as GMAC. And there's also a program right here in SUNY Downstate and Kings County known as Guns Down, Life Up, which is geared towards reducing the number of gun violence amongst the youth in the community.
And most importantly, we have KAVI. KAVI stands for Kings Against Violence Initiative, but it's actually a Sanskrit word that has a lot more meaning than that. And Sanskrit is a language that is developed by Buddhists, and this word means leader, wise man. And so what we are trying to do with KAVI is train youth to become community leaders. And we do that in 3 ways. We do that with our community intervention, we do that with our school-based intervention, and our hospital-based intervention. And I have the privilege to develop and create programming for middle school youth right here in this community, where I have a after-school program at Kings County Hospital that we meet on Mondays and Thursdays, and we also host tutoring on Wednesdays. And we do this to provide a space, a safe space for kids to come and explore their boundaries, and we do our best to link them with people, with organizations, with opportunities so that they can grow and become whoever they want to be.
I have the pleasure to volunteer with KAVI in our school-based intervention, where I go to Wingate High School, just 1 block away from Kings County, where I work with students from the School of Human Rights, as well as the High School for Public Services, where I can not just serve as a mentor and a role model, I can sit there and empower the students themselves, let them know that they don't have to live a life in an impoverished neighborhood, that they can grow to be more than what the outside world tells them that they will be. They can be more than just a statistic. Within this school-based intervention, I'm able to sit there and not just tell the students what to do, but I'm able to sit there and listen. One thing that I find that us as adults, something that we do and we may not notice, is that we like to come up with a lot of different solutions, but we never really understand what the problem is. We don't go there and we don't go to the students and ask them, hey, what's going on with you? What's wrong? Why do you feel like you need to retaliate? Here at KAVI, I'm able to sit there with the students on an even playing field and ask them, hey, how's your day? What's triggering you today? What's wrong? And have young black males open up in ways that I've never been able to, knowing that when I was in high school, I didn't have that outlet. And KAVI provides the outlet for these students themselves.
And finally, we have our hospital intervention, where we have hospital responders respond to victims of violence from the ages of 12 to 25, where they try to link them with organizations, with services to help them heal and deal with their traumatic event.
Now, the last question is, what can you all do?
And we believe what you can do is find organizations similar to KAVI, similar to Guns Down, Life Up, similar to all the organizations that we put before you, and contribute in some positive way to mentor the youth and help usher along the next generation as we all try to deal with what's before us. Again, my name is Tendaji Bailey.
And I'm Muhammad Muratalla.
And thank you for your time.
Thank you.
You guys want to stand up, sit down, whatever's comfortable?
I want to get on you guys playing field. I'll take a seat.
So we have approximately 15 minutes open to the floor for questions and answers. And I'd like to stress, please ask questions. I mean, if you have longer comments to make, the gentleman will be here through when we're serving lunch, and that would be a more appropriate opportunity. But I ask you if you have any questions, please raise your hand and we'll call on you. Anyone? Comment? Questions? Yes.
Do you also team up with the local precincts to get them involved with this hobby?
The local police precincts? I have met with one of the police officers in the community. I can't think of his name right now. But we try to bring in different speakers to speak to our youth, and we would like to have them do some workshops with us as well. So, yes.
Yes.
do the groups also address life?
Oh, sorry. Your question was how do we teach and discuss microaggressions? And what I will say is that before we can have a discussion about microaggressions with our students, we first have to really identify and understand with them what racism is. There's a lot of ideas and thoughts about what it is, what it looks like. And so we don't necessarily go to microaggressions first, but we try to teach what it is. I think that we can get to that maybe in our high school programs. I work with middle school students. And there's a lot of just instances and things that kind of come up, especially over the past year, where we're able to like identify what white supremacy is, what racism is. But because they are in a space where most of the teachers are black and most of the students that they're around are black, they don't necessarily experience the microaggression yet. But it is something that we can definitely incorporate in our...
I'm a psychologist, so I could make a comment on that. And I was a school psychologist, just so we know that it's not just others who do it. You know, so I know that your programs are good. So I'm not even going to talk about that. Maybe we'll talk about it offline.
I just want to bring up, within our high school program there at Wingate, we actually do talk about microaggressions. We actually just completed an oppression module where we spoke about what it means to be the oppressor and the oppressee and how that can transgress into actual, like, direct aggression as well as microaggressions. So the students in the high school are aware of it, and they're aware of the violence that they inflict on each other. They're aware of the violence that gets inflicted on them, and they'll continue.
One of the things that you alluded to, and I'd be curious to know if you've gotten involved in this or there are other community resources that might be involved in this, is the whole issue of adverse childhood experiences, which CDC, of course, has a major initiative in that area, and how that plays into the work that you do, whether you do assessments. As I work with nursing students, and I'm really interested in, one, what experiences do our providers have in terms of adverse childhood experiences affecting their health and taken in a holistic way, and then also how that's not part of our curriculum and not an explicit part of our curriculum. So what can we do about changing the way in which we prepare health providers to do these kind of assessments and also to provide access to resources such as yours?
So, I don't know if I can repeat your entire
Do we
question.
do assessments?
But when it comes to assessments, here at COBI, as a research analyst, we, in the beginning of the program, when students are registering, we actually do have them fill out a complete application which incorporates an assessment that asks about their social needs and what they may or may not be lacking. And more recently, I've actually been putting in new data for our recent curriculums, asking them about not just the curriculum itself, but asking them about how they're feeling. And that is a part of COBI that it's very hard to put into data, because when it comes to a child's health and what a child needs, most programs, most organizations, all they want to look at are graduation rates, or they want to look at what grades you get. And I'm not saying that's not important, but the other aspect that COBI really focuses on is, yes, we have tutoring services, but we also provide services for the heart and mind. We provide services, emotional services that they may be lacking. They don't have any outside support. So us here at COBI, we're able to teach them a little something, we're able to learn from them, and we're also able to provide emotional and mental support.
Can I just also address that? My name is Jaquel Clemens. I'm COBI's Chief Operating Officer. Hi. One of the things I will say is that we're really interested in creating a learning community within the SUNY Downstate, Kings County, and with our partners around trauma-informed care and resiliency approaches. We just recently got a grant to actually do that, and so we're hoping to bring people in so that we can create train-the-trainer models. We do, we recognize that there isn't a whole lot of available resources on trauma and resiliency and building those things that where we can access easily in terms of trainings here in New York. So we've been going to Pennsylvania and to Philly, working with CHOP, the Children's Hospital of Philadelphia, and with the program, the Violence Intervention Program at Drexel to just learn more about trauma-informed approaches. And it's something that we hope to bring to the community here. So, yeah.
You got my card already.
Absolutely.
Thank you for your question. Yes, ma'am.
Is there any aspect of copying that deals with parents and the caregiver, whoever the caregiver is for the children who are in the program? Because sometimes when children are, especially adolescents, who are learning different ways of coping and so forth, and they try and take those skills into the household who's done things differently all their lives. You know, in the Black community that I'm from, you don't talk back to your parents, you don't express too much about what it is your opinion is. As a matter of fact, there was an expression when I was a kid, kids should be seen and not heard. So if we don't have some way of dealing with what they're being taught in terms of their newly acquired values, and the values that may exist in their home, it may become another source of frustration and disappointment and violence. And so I'm just wondering if there's any way that parents or primary caregivers being incorporated into some of the information and skills that you're giving to adolescents.
So she's asking if we are providing services for our parents. And the answer to that is yes. We are organizing workshops to provide support for parents to learn how to have the talk. And there's several talks that need to happen. One of them are around how to deal with racism and white supremacy. I remember watching Grey's Anatomy a few weeks ago, and Miranda had to sit down with her son, Tuck, and kind of talk about what an interaction between a police should look like. And so we want to kind of train parents to have that discussion with their kids, as well as conversations about sex and conversations about just life things that kids deal with. So we definitely want to provide as much support for parents as they're dealing with raising their kids.
And one other thing is that in addition to speaking with the students, we also speak to the parents. They know that the students are in the program, and they understand everything that we're doing with the students themselves. And we constantly check up on them. We check up on them, especially if the students may not be doing well in school. We make sure we let the parents know, hey, they seem to be going through these difficulties. What more is it that we can provide? What more is it that you're okay with us providing? So we have a close interaction between both the parents and the students.
So this should be the last question.
Oh, okay. Hi.
Hi.
My name is Ellen Jean Richards. I'm a pediatrician. I am supposed to be in pediatric grandmas, but this was more important to me.
And I want to know what we can do to help, because I do these assessments all the time. I find lots of violence in the home. And as you know, I understand where you're situated in middle school and the high school, you're starting at age 12. But we really mean these things started from much younger. But what can we do? Because we're assessing kids all the time. We're finding the trauma. We're finding the effects of the trauma. But we don't know what to do with it when we find it. They now want us to screen without resources of where to refer. So it would be nice knowing that there's a community initiative out there that we could partner together so we don't feel frustrated. We don't feel like all of our work is in vain. And we also know it can connect with the community that's doing it also. I think that a lot of things we do are well-meaning, but they're very disjointed. And so it'd be nice to connect so that we know, okay, so once we identify somebody, this is what we do with them. Once we see that there's an issue, this is how we approach it all together. So, I mean, you guys might not know, but your coordinators might know what we can do.
Can I share with you? I know there are some models around the country dealing specifically with adverse childhood experiences, some community-based models that have really gotten into this. And I do have a consultant that I'm working with on some of our ACEs work, that if we could get a group of people when she's in town, we could all sit down and just sort of talk about what's going on and what we might think about doing. That would be awesome.
Yeah. There's some really great resources that are not tapping to Safe Horizon, offers like trauma-informed services. GTR, which is on Church Avenue, right around the corner, also offers trauma-informed counseling, works with families with young people, and these resources are not like heavily used. So I'll pass on it.
Thank you for your question.
Thank you very much for this section of our program, and to let you know, thank you, gentlemen. There are flyers in the back, Kavi's recruiting tutors, so if you're interested, I put them strategically near the brownies. So if you're interested, please pick up a flyer and follow up with them, but thank you.
And now on to the second half of today's events. Again, my name is Dr. Anika Daniels-Osaze. I'm the Director of Diversity Education and Research here at SUNY Downstate Medical Center. I'd like to introduce you to Dr. Carla Booten-Foster, who is the Associate Dean for our office, and I'd like to ask her to come up and join me. All too often, we spend so much time here working and making sure everything goes well, but we don't always take the time to stop and thank the people who help us get our jobs done. And before I even get into our awardees, the one person I wanted to acknowledge right up front is Ms. Shamika Bowman, who's in the front right now, helping us just getting the awards together. And she is so amazing. If you only knew the work that she does behind the scenes to make sure that our office can get our things done, you wouldn't believe it. I mean, even with the awards, at the last minute, we panicked because of the holiday weekend. The awards were delayed. And we were begging UPS to get them here on time. And of course, they didn't really want to do anything to accommodate, but they said, if you want, you can just come and pick them up. And she was willing to go and get them and bring them to the institution without being asked. You know, because she wanted this to be successful. She wanted everything to work out. Luckily, she didn't have to do it, but just the idea that she offered to do it was amazing, along with just getting the food and making sure we had our RSVPs and everything together for this event. So I just really wanted to say thank you so much, Ms. Bowman, for always having our back and making sure everything goes well. So let me just get into why we're doing this and who we're doing it with. So we decided to name this after Dr. Samuel L. Kountz, Jr., who was an African-American kidney transplant surgeon from Lexus, Arkansas. He was most distinguished for his pioneering work in the field of kidney transplantations, research discoveries, and inventions in renal science. Dr. Kountz, Jr. was appointed chairman of the Department of Surgery at SUNY Downstate beginning in 1972 and was a surgeon-in-chief of Kings County Hospital Center. So he was a pioneer in the work that he did here at SUNY Downstate, and we wanted to honor him and his legacy by having this lecture series, but also recognizing the men here who do so much great work at Downstate. So often we don't acknowledge them. We do have our Women's History Month celebration, and for years we've always given awards to the women here who've done great work, but there are so many men behind the scenes who do what they do quietly. They don't expect anything in return. Without them, we wouldn't have someone for our students to mentor. We wouldn't have students to have anyone to do research with. We wouldn't have a clean environment to work in. We wouldn't feel secure and safe at our jobs, you know, especially in line of what's going on nationwide, and we're constantly worried about our safety and whether we're going to make it home or not. So we have to honor those who are actually holding us down and protecting us and making sure that Downstate continues to be a safe environment, that Downstate continues to be a clean environment, that you know, some of us wouldn't even have jobs here if it weren't for some of the individuals who do the paperwork behind the scenes to get us our clearance, to make sure that we can get what we need to do what we have to do. So that's what this event is all about. And I asked Dr. Booten-Foster here, not only because this was her vision, but also because I wanted her to also be here to celebrate those who we would like to call up today. So we're going to start off with the Diversity Champion Award, and I'll have her say a few words about our recipients.
So thank you so much for coming, and I know I'm standing between you and lunch, so I will be brief. You know, about a week ago, I think we were all, we all woke up to the news of 17 individuals losing their lives prematurely, unnecessarily, without a reason. But today, I am filled with hope. You know, I am filled with hope that at SUNY Downstate, we are making a difference. And that's what makes me proud and happy and feel blessed to come here every single day. So if you want to know how do you make a difference, these are examples of how you can make a difference in your community. Dr. Kountz was an example of how to make a difference. So if you're thinking of what do I do, come to SUNY Downstate. We have many schools. We have our School of Nursing, our School of Public Health, our School of Medicine, our Graduate School of Sciences. We have our College for Allied Health Professionals, you know, shameless plug for admissions committee. But we are here, make a difference, be part of the solution, be part of the solution. So as Dr. Daniels Asazi say, I have to thank Ms. Bowman again. My right hand, my left hand, my feet. You make it happen, thank you. And this would not have happened without Dr. Daniels Asazi. She made it happen. She really did. And I am truly blessed to have you just dynamic women in my life. And at SUNY Downstate, we are better off because of you too. So now to the award recipients. So should I just call everyone and have everyone come together and? Sure. Okay. No. One at. Okay. No. You guys want your spotlight? You have your speech prepared one at a time. Okay. You know, like it's like I have my speech prepared. I got like to thank. Okay. So so the first and this is not in any order. It's just the way I'm reading it off is Dr. Clinton Brown. Where's Dr. Brown? So Dr. Brown has been a mentor to me since I was a medical student. Yeah, no, you're right. It's not that, it's longer than that. He actually went to school with my father-in-law when he was a medical student here. So Dr. Brown holds a special, he really, in terms of the diversity awards, you know, at SUNY Downstate, we celebrate a legacy of diversity. It is not by accident. It is through hard work, commitment, compassion, and intentionality. This attention that we pay to really recruiting the best and brightest and mentoring them when they get here. So when I got here as a student and I saw Dr. Brown, he made me feel like I belonged here. And for this, I thank you. I thank you. I thank you. I thank you. The podium is yours, sir.
And it reads, Dr. Samuel L. Kountz Jr. Diversity Champion Award presented to Dr. Clinton Brown for your dedication and commitment to diversity. Yes, no, you should say something. You got the mic.
Well said, Dr. Brown. Thank you. Our next recipient is Dr. Joseph here? Oh, doesn't matter. Okay. So well, no, it's okay. Is the other Dr. Joseph here? No? Don't? Okay, well, come on in. So the next person, actually, I knew of Dr. Michael Joseph before we actually met because I heard about this place, SUNY Downstate. You know, that's what's up. They make it happen at SUNY Downstate. And there's this scholar, this public health scholar, Dr. Joseph, who's really down to earth, and he understands what's going on. He's a spiritual man, and he can preach and do public health at the same time. So you need to meet this scholar, Dr. Joseph. So when I came here, one of the first things that I did was to meet the Dr. Michael Joseph, who really understands the importance of blending public health with the clinical sciences to truly address the health disparities and the health inequities and the injustice that exists in our community. So, Dr. Joseph, I heard about you before I came, and I'm glad I am here to know you.
We give the Excellence in Mentoring Award to Dr. Michael Joseph.
I'd like to thank the members of the Academy. But in all seriousness, I live my life through this wonderful song that I learned when I was in elementary school by Mahalia Jackson. If I can help somebody as I travel along, if I can help somebody with a word or with a song, if I can help somebody from doing wrong, then my living shall not be in vain. My living is not in vain.
Amen. So this next recipient, I just got here about 2 years ago. I went to medical school here, and then when I came back, it was lonely because I didn't know anyone. And then Dr. Daniel Zasazi introduced me to Dr. Roman. And she said, you have to meet Dr. Roman. He's a basic scientist, and he gets it. He really understands. He gets it. He's down with the cause. You will not do anything without Dr. Roman. And I met the Dr. Roman. And several months ago, 2 medical students approached me and said they wanted to develop this curriculum in which students can address health equity, advocacy, and leadership throughout their medical school curriculum. And I'm like, well, I don't know how it's going to happen. Maybe I should talk to the Dr. Roman about it. And I spoke to the Dr. Roman, and he made it happen. So I'd like to call the Dr. Roman to receive the Excellence in Mentorship Award. It takes a community at SUNY Downstate, and he has been such a strong supporter of the office. He mentors our students. He's mentored our medical students, and I am just truly blessed to call you friend and colleague.
Thank you.
But mostly friend.
Thank you so much. Can I hold you first? Nice to meet you. You'll get yours later.
You gotta say something.
Okay. I don't know what to say. I'm a guy of few words. Looking at the faces in the audience, it's kind of emotional. When I think about mentorship awards, I heard 2 paradigms of mentorship. So I applaud you for that, of all the incredibly important work that you're doing. I know that there are a lot of other mentors in this room. And as I told Dr. Daniel Zasazi, I see mentorship as a continuum. It's pluralistic. It's sort of like Indira's net, where all of these little pearls are sort of reflecting each other, reaching into the past and hopefully projecting into the future. And you're doing that. You're making a difference for individuals. There you are. For communities. I mean, that's really powerful. So I have a tremendous sense of gratitude, appreciation, and humility to your work. And to everybody who I don't know what you're doing, but I'm sure you're doing great things too. So with that, I also, Arthur Ashe, I think, resonates with me. I'm paraphrasing, but and you'll correct me, but I think what I take away was, you look around and you do what you can. And so I'm just a science guy. What do I know? I'm a lab rat. I like doing experiments. But I know that there are some skills that I could offer, and because I have such amazing colleagues and friends in the Office of Diversity and Education Research, the staff here at Downstate, like Ms. CC in the audience, then everything can fly. So this is really for everybody, for all of you. Thank you.
And so we talked a lot about safety and its importance. So often we walk into the building and you don't even acknowledge the person that's standing right there waiting to protect you. And I think it's really important that we take the time to say thank you to those who have kept us safe, who look out for us, who have our back. Before I can even say his name. Officer Keith Callum does it with such a smile. You know, the students love him. The workers love him. We all love him. And it's so important to us because when we walk in, no matter how hard it is, when you come in and you have so much on your plate and you're trying to get through that to-do list, the first thing he asks is, how are you doing? And he means it. It's not just a New Yorker way where you're just walking by, hey, how you doing? And keep on going. He actually wants you to respond. So that's why we really appreciate you. We see you. We know that you're here for us, and we just want you to know that we appreciate everything you've done for us.
Sorry. Technical problems.
Okay.
I have left my speech at home. But one thing I do carry, a big thank you.
Now, where do I even begin with Mr. Ludo? This man comes in at 4 a.m. in the morning sometimes, leaves at midnight other times, is here on weekends, weekdays. Not one person working here has not had to go through him to get their clearance to even be able to work or study at this institution. But how often do you actually see how he's doing? Because he works really hard. He's someone that is here all the time. I don't even think you even take vacation. Honestly, because even with our summer programs and the work that he has to do for us, we bring in anywhere from 60 to 80 students during the summer, and they all have to go through him to make sure that they're cleared. And he does it with no complaints, even when he's short-staffed and it's just him, and he has to meet with everybody who walks into that office. He does it, and he does it with pride. And we so appreciate him for that, because it's hard to do what he does. And I don't think many people even know who he is because he's behind the scenes. So today, everyone's going to know who you are. That's why we have your picture up here. We want you to come up and accept your award, Mr. Roger LeBlanc. Anything you want to say?
Yeah, I just have
to thank my department, my colleagues, and I practically work with everybody here.
Yes.
On a regular basis. Just don't see me all the time, just everything phone or email. So I really have to thank everyone here for the support and for making me do what I do. I like what I do. Thank you very much.
Officer Robert Keyes could not be here with us today because he's working hard. I know he's doing a training out in Rockland County for his colleagues, but I just wanted to say that he's also someone who's always protected us to make sure that we're safe here. And to the point where when we had our campus shooter presentation and some of us couldn't attend, he made it his point to locate every office who was unable to attend and do a special training in that office for them, looking at the environment that they work in and even giving them advice on how to utilize their space to be able to be safe. He actually saw what could be used as a weapon if necessary in your particular office to protect yourself. And the first thing he said was, don't hide, fight. You know, don't crawl under your desk, it's not going to work. I'm going to teach you how to fight for your life and the lives of the other people in your office. So we appreciate him for that. And is there someone from his department that can accept the award on his behalf? If not, we'll make sure that he gets it. Yes, thank you. And your name, sir?
Paul Aline.
Paul Aline, and you're here from campus safety?
University Police.
University Police. So we'd like to make sure that he gets that, please. And thank you for taking it from him.
A couple of quick things.
Sure.
I've had the pleasure of working with Officer Keyes probably for the past 18 years. As many of you have said, or if you know Officer Keyes, he goes above and beyond all times to help those in need. It's very he sends his regrets that he couldn't be here today to partake in this event, but on his behalf, I thank you.
My man, Mr. Joseph Hawkins. He's one of my favorites. Is he here today? Yes. He's chilling in the back, always in the cut. But Mr. Hawkins, I get to see him frequently on the second floor. He is always there to tell a joke, to check in on you and make sure you're doing well. He's another person who asks, how are you doing? And they mean it. You know, he's always there to make sure that the environment that we work in is a clean environment, that we don't have to ask him to do anything. He always takes the initiative to jump up and do extra. You know, there was one time I remember I lost my wallet here. And I had just mentioned it to him, not asking him to do anything, and I was devastated and I was stressed out. And he went and searched for that wallet just because he wanted to make sure that I felt better and that I had what I needed. You know, whenever we need any kind of supplies in the office, he's there. Sometimes if we just need someone to talk to, he's there. We see him in the hallway, and he's just looking out to make sure everybody's happy, and he works hard. He's here all the time. We see him covering for people who may not be doing what they're supposed to do, but he doesn't complain about it. He just does it because it needs to happen. So he needs to be appreciated for the work that he does, and I'd like to call him up here so he can get his congratulations. You see in his picture how suave he looks. He knows. He knows he has it going on.
First of all, I want to thank Ms. Anika, Dr. Foster, are amazing. It's a joy to come to the office every day to see pretty smiles. Thank you once again for this incredible gesture. I greatly appreciate it. And you know I dream to do this.
Okay, and last but not least, yeah, but he has the whole entourage back there. Mr. Victor Ruiz, who has worked at admissions for several years, but has just worked with our office since I got here. I mean, I feel like we've been here since the beginning, right? I've been here for 18 years, and you know, there's never a day when I've asked him for something that he hasn't gotten it for me. And Victor is one of those people who knows everything that goes on in his office, and no matter whether it's his role or not, he can answer the question or he'll find the answer for you. He's that type of person who doesn't say, I don't know. You know, he's like, I'll find out, I'll get back to you, and he never forgets. He's always the one who does the follow through. And I know he has so much paperwork that he has to deal with. And there are times when we're constantly emailing him like, can you do this, can you do that? And I'm sure we overwhelm you. But he never says no, maybe to his own detriment. But, but as you can see, he has a supportive staff. They're all here to have his back and to let him know how much he's done and how much we appreciate you. So Mr. Ruiz, if you can come to the front. He's also my buddy I get to talk to about superhero movies, so we have a lot to talk about with this Black Panther movie.
I gotta go see it.
Take your word out. Show it.
Take your word out?
Yes. Why not? There we go.
I might drop it.
You ready? One more.
Hey, can you turn this way?
You want to turn this? Come on, everybody.
Oh, great. Dr. Joseph made it. Yes. Okay. Carla.
Really quickly, I just want to say thank you. I'm looking across the crowd. I see faces. I mean, I've been here 26 years now. I know quite a few faces here. You've probably seen me grow up from the hallways in the very beginnings. I see some of the students I helped. been in our office. It's been a pleasure. I think, when we start out, whether it's for work, whether it's our education, we may not necessarily know our direction. But deep down inside, we truly know what our calling is. And when you find it, you gotta latch on and go with it. Someone told me, if you love what you do, then it's never really work. So I think I'm enjoying what I'm doing. It's a lot of work, but it's very fruitful, and I appreciate it. Thank you so much.
So, last but definitely not least, Dr. Anthony Joseph. So I met Dr. Joseph, again, when I was a medical student here, and he was such a strong advocate, such a strong proponent of diversity. He now co-chairs the admissions committee, and he's mild-mannered, and you think he's quiet, but when it comes to advocating for our students, watch out. So I am so blessed to have Dr. Joseph as a mentor when I was a student, and now as a faculty and colleague. So Dr. Joseph, we'd like to honor you for all of the work that you've done at SUNY Downstate in promoting diversity.
I have to thank my mother besides thinking that in the community. When I was a kid, I was not that good. I still remember when I was 4 years and a half. I was in kindergarten, and I went to the teacher. I said, you have to do something about those kids because they are stupid. They cannot learn. Then the teacher gave me a terrible look, and she talked to my mother. My mother said, listen, you may have a lot of skills, but there are people who don't have it. And you have to tolerate them. You have to be compassionate. You have to help them. But that was not good enough. When I was 7, there was an Adventist, Seventh-day Adventist church not far from where I was living. And every Saturday I looked at those people asking me, I said, what's wrong with them? I don't like their hat. I don't like their I don't like their weight. I don't like their dresses. And then I said, well, why do you only have to go to church on Saturday instead of Sunday? But I kept saying the same thing every Saturday. And one day my mother listened to me and she said, son, we have to talk. You are serving the same God. You are not better than those people. That was not good enough. When I was 8, in the beginning of the year, there was a Syrian guy in the class. And I said to my mother, why do we have to have a white guy in the class? My mother said, oh my God. I don't know what to do with you. And then she went to the same speech, but I was not even better. When I was in high school, I'm 12 years old, I bought some oranges, peeled them, sliced them, and I beat all of them. The priest who saw me said, we have to talk. Why did you do this? I said, I don't know. He said, I'm pretty sure I know. You don't want to give any to anybody else. And he said, I will talk to your mother. So you can imagine, I was not that good when I was a kid. But with times, I learned from my mother, from my advisors, and here I am today. Thank you.
We wanted to thank Dr. Mary Valmont for being here today and for all of her help. We'd like to thank the entire Arthur Ashe Institute for Urban Health for their support, everything from helping us get the flyers out, getting the word out, actually notifying the entire campus of this event. They've given us so much support throughout the year, so we really appreciate the entire Arthur Ashe Institute for their help. Okay, anything you want to say?
No, thank you again. The Health Science Academy students, make sure that either myself or Ms. Lewis know that you're here, and we'll soon be serving lunch. And I just want to remind my students to, act like I always tell you to, particularly in front of people. Thank you.
And thank you again to our keynote speakers from CAVI, Mr. Tendaje Bailey, and Mr. Mohammed Mutarala, right? Muratala, excuse me, Mohammed Muratala. Thank you so much for being here, and thank you to our audience for being with us. And now we're going to get ready to break open lunch. Thank you.